On behalf of Access Health International, I would like to extend a warm welcome to all the members and the participants. To me, I think this is a very important milestone for health systems in the country. This has been going on. I think the dialogue has been going on for a few months now. And it is a great moment that there is a name and form to this collaborative. So the name, India Health Systems Collaborative. And the form, I think the legal entity that is going to give the platform for the various stakeholders who are interested in strengthening the health systems in a collaborative spirit. This is the most apt time. I think even before COVID pandemic, the country has been witnessing some of the major ambitious reforms in the policy space. Ayushman Bharat, its ambitious implementation and strengthening of the primary health care, and also its ambitious intent to achieve universal health coverage through PMJ and further expansion of the PMJ and pooling of various fragmented payer systems. In addition to that, there was another major reforms, not much noticed, but I think the reforms related to the medical education in the form of National Medical Commission, I think which recently the Parliament has passed the act. In addition to that, the COVID itself has brought health onto the top of policy agenda. I think this is the most opportune time for people who are interested in the health system strengthening to seize this opportunity, because the government, the public, the various stakeholders, various actors in the health systems, there is a huge positive impetus for this agenda. And to take up this agenda, to seize this opportunity, I think unless there is a collaborative spirit of limited people in the country, country of India's size requires a lot more researchers, a lot more advocates of strengthening the health systems. Given this background, and given the impetus that the health systems are going to get from the policy space, not only at the center, but across the states and even the global health level, there is a need for orchestrated policy research, both to push the agenda as well as to support the policy formulation, and more importantly, to support the policy implementation of such a country-level ambitious program. The announcement of National Digital Health Mission, again, another major reform got thrusted because of the COVID into the forefront. It also will enable the strengthening of the health systems to a great extent. The areas in my mind which need attention, which are not getting enough attention, is still how the healthcare is going to be organized, especially given the mixed health system that we have and the disruptive healthcare delivery models that are coming up with the advent of digital health and the online platform systems. So there is a need for good research in how to organize an effective healthcare delivery system. The second area which needs the impetus on the policy is, while we are trying to provide access, we are not focusing on what quality of care people are getting. I think quality of care needs much more impetus and the focus by all these collaborative members. We still don't have a health systems performance assessment framework at a national and subnational level. Because unless there is a defined framework, we will not be able to actually monitor what is the impact of these major reforms and policy implementation on the health system. So I recommend that the collaborative to look into this aspect and influence the policymakers to define a framework for the country so that there is a uniform measurement of the performance and the impact of some of these reforms on the performance of the health systems. And lastly, I think another area which needs much more attention than what it is getting is how do we strengthen the human resource for health? COVID pandemic, in fact, glaringly threw up that challenge that the government was able to create the infrastructure, but was unable to provide the human resources needed to manage the infrastructure. Most of the infrastructure created was fairly unoccupied just because they could not be operationalized for lack of competent frontline health workers. Health systems, as they become more complex and unmanageable, it requires equal emphasis on how we are regulating health systems management courses. They are growing in an unregulated way. Is there a need for regulating management courses? So these are some of my thought process as to the collaborative members. I hope that by next year, this collaborative membership increases to many more thousands, so that there is enough manpower to undertake policy relevant health systems research and supporting its implementation. I think with these few comments, I wish all the participants a fruitful webinar today. Thanks, Maulik, and thanks, Tushar, for giving me this opportunity. And thank you all.